Continuing our conversation about wellness, it's summertime, everyone's thinking about their weight. I'm here with best-selling author Tanya Zuckerbrot. Nice to see you.
Good to see you, Eric.
Okay, so for people looking to lose a little weight this summer, do you have any quick tips?
Well, my program, the Ffactor diet, is based on combining 2 foods at every meal, fiber and protein. So my first tip is get more fiber in your diet. And fiber is not your grandma's fiber. It's not dried prunes and Metamucil. Fiber-rich foods are found in whole grains, whole wheat pasta, raspberries, beans. I mean, they're in so many nutritious, delicious foods. Now, the reason that you should be adding more fiber to your diet, aside from all the health benefits, is that fiber helps to keep you feeling full. So as summer rolls around, you want a flat stomach and thinner thighs. Eating fiber helps you lose weight without hunger.
And thinking about wellness, a lot of people think you have to suffer if you're on a diet or you have to suffer when you're working out. Do you have to do that?
People always say, does the Ffactor diet work? And I say the Ffactor diet is no different than any other diet out there. They all work as long as you follow them. The issue with most diets, whether it's Ffactor or South Beach or the cookie diet or the grapefruit diet, is that they all have to create a caloric deficit. And typically, that's where the feelings of deprivation, denial, and hunger come into play. Or some of these other programs where you're forced to sit home with a frozen meal while all your friends are out to dinner, those don't work either. So the Ffactor diet is so efficient and I think so easy to embrace as a lifestyle because, one, you're eating breakfast, lunch, snack, and dinner. You're always full. You can go out to any restaurant from day one, and you can even drink alcohol in moderation. So you don't have to sacrifice your social life in order to be on the road to looking and feeling your best.
And what's a little unusual is you actually have a lot of guys who are on this diet, correct?
It's surprising what % of our patient population are men, and it's almost 50%. And I believe that the reason that this program works so effectively for men is twofold. One, the program works for men because men tend to follow directions. Men are soldiers. You give them a pair of pants, a jacket, and a shirt. They're dressed for the day. And women need to accessorize. We need to change our pocketbooks and our scarves. So I always find that women tend to tinker with the diet more, and then when they come in the following week and they can't understand why it didn't work, I'm like, well, you switched your breakfast for your lunch. So men tend to get the program and follow it. And the average weight loss for men is around 15 pounds. But I think the other reason that the program is so popular among men is that so many men sit down with me like, Tanya, the reason I'm here is because I heard I can drink on this diet. For social reasons and business reasons, many men are not willing to forego, drinking socially in order to lose a few pounds. And nor should they, because first of all, you don't want to create habits that aren't sustainable. Because anything that you're doing to lose weight that you're not going to keep up with means that that weight loss that you lost because of that act is going to come back on. And interestingly enough, in Europe, they drink wine with almost every meal, with lunch and with dinner, and they don't have the incidence of obesity that we do. So you can drink in moderation and still have a quality of life.
And if someone's going to get on the Ffactor, how long before they see results?
Typically, you see results within the first 2 weeks. The average weight loss is 4 to 6 pounds. By the end of your first month, most women are down 10 pounds and most men are down 15 pounds.
And speaking about fiber, you didn't originally set out to actually find a weight loss solution. You were doing some other research, right?
Well, I always laugh when people call me, oh, aren't you that fiber lady? I'm like, we've got to come up with something sexier. There's got to be a better title. But yes, I did create this program called the Ffactor Diet, but its roots are really based in a clinical setting. I did not set out to become this weight loss guru. In fact, when I went into private practice, I wanted to apply nutrition intervention to the patient populations where I felt I could have the most impact from a health perspective. So I was actually focused on cardiovascular patients and diabetic patients. And my job was to create diets that would help lower cholesterol and control sugar levels. After following the programs I created for 3 months, we repeated the blood workups, and what we found was the cardiovascular patients did lower their cholesterol. The diabetic patients did have better blood sugar control. But something else occurred. Across the board, everybody lost weight. And even I'm scratching my head going, why is everyone losing weight? I realized the common denominator between these two diets was that there was a lot of fiber in both.
And quickly, just give us a rundown on why people need fiber in their diet.
Sure.
And if there's a deficit in our modern diet.
The American Dietetic Association recommends that women get 25 to 30 grams of fiber a day and men need 38 grams of fiber a day. Unfortunately, the average American only consumes 9 to 11 grams of fiber a day. So to say that there's a deficit is an understatement. We're only meeting 1/3 of our fiber needs. Now, of course, fiber has weight management properties. It helps to keep you feeling full on few calories. And that's great because we're seeing an incidence of obesity in this country where currently 2 out of every 3 Americans are overweight, and out of those 2, 1's obese. But that's just the aesthetics. If you get past that, there are other benefits of fiber, which are their health benefits. Dietine fiber have been shown to not only lower cholesterol and control sugars, therefore reducing not only the risk for cardiovascular disease and diabetes, but fiber lowers blood pressure, reduces risk for colon cancer and breast cancer, and the most recent study that was just published shows that dietine fiber actually help you to live longer.
There you have it. Not only do you need to get in shape for summer, you also need to have fiber.